President Trump has signed an executive order demanding federal agencies bring down the high prices of prescription drugs. It sets a 30-day deadline to negotiate lower drug prices. But what does this really mean?
Right. We are joined live by benefits consultant Patrick Moore. He's the co-CEO of Pretext, which is a firm that helps people navigate the complicated world of health insurance. Thank you so much for being with us this morning.
Well, thank you very much for having us, ladies.
Okay, so the efforts to lower prescription drug costs is not new. How does this executive order differ from what we've seen in the past?
Well, it's like completely different, actually. It has the potential to be huge. What I would say is what this measure is affecting is all of the drugs. What we've seen in the past is a lot of things that are affecting more Medicare and Medicaid, but this is the way it's written, right? We don't know how it's going to play out, but the way it's written, it's all healthcare drugs. It's all employer-based plans as well as individual.
So that's, yesterday as we were listening to this announcement at the White House, the president went after pharmaceutical companies, talked about how they've driven up prices, talked about how his friend's fat shot was significantly cheaper in Europe than it was here. It was something that we kind of giggled about, but at the same time, I think a lot of people related to it. How will this have an impact on those pharmaceutical companies and then how it plays out with consumers?
Yeah, the fat shot, right? Like you can buy Mounjaro in India for $50. You can buy Ozempic and Wegovy for $350 in some of the more well-known countries like in England or Canada. And so it matters, and the reason it will bring down cost is if it's implemented, you're going to have some price transparency. The problem is in America, we don't really have transparency on what things actually cost. I mean, most Americans get their coverage through their employer, right? Like you ladies probably get your insurance, which is your access to your prescription drugs, through your employer. And the way we buy drugs through an employer is completely different than the rest of the world does.
Right. So
yes, and thank you, Paramount.
I was going to say, we don't actually always know the cost because I don't even like to look at the real bill. Okay, so are you confident that this is actually going to lower cost for prescription drugs across the board?
If it gets implemented, it would 100% bring down costs. I mean, the example I would give you is Humira, which is probably one of the more well-known drugs for rheumatoid arthritis and some of the tougher disease states in this country. It's like an $8,000 a month drug, ladies. $8,000 a month. You can buy that in Israel for $1,000.
Wow.
And so if you were actually looking at the international prices and being able to access those in an easy way and getting those from the manufacturers, it would 100% bring down the price of drugs.
Okay, so how fast can this happen?
I mean, it's probably not going to happen, right? So this is the problem, is that you have a bunch of middlemen in the way of this being implemented. And so you would have to change the contracts that they have with employers. You have to change the contracts they have with insurance companies. And that's going to be the biggest hurdle. But I mean, regardless, it's a great first effort.
Okay, so not feeling too confident it'll actually happen, but you like the idea of it. You like the idea of it. Okay, Patrick, we do appreciate your insight. Thank you for being with us this morning.
For sure, ladies. Have a good day.
All right, you too.